is it okay to breastfeed when you have MS? And how does it work with the hormones that are involved with breastfeeding? Do they have any protective effect against relapses?
Yeah. So firstly to say, absolutely it's okay to breastfeed with MS. MS shouldn't stop people from breastfeeding. Again, thinking about some people who may have sort of specific disabilities, it may be that you need a bit more help from breastfeeding counselors, from breastfeeding services to work out the mechanics of,
Mm.
how to hold the baby um, to achieve successful breastfeeding. 'Cause breastfeeding is something that you have to learn as a partnership between you and the baby. It's not easy. It doesn't come to most people very naturally. So, and some people, regardless of physical disability, need more help than others with that. And particularly in people with some specific disabilities, they're more likely to need help with that. But so I think the first thing is to say MS isn't a reason not to breastfeed, but don't be afraid to ask for help if that's what you want to do. Um, in terms of breastfeeding and relapse protection, we think that exclusive breastfeeding or exclusive breastfeeding with pumping does provide protection against relapses for at least around 3 months after birth, potentially up to 6. So it's sort of slightly time limited to the first bit when the baby's quite young before they start weaning. It's not perfect, it's probably equivalent to a fairly moderate efficacy DMT at best. Having said all of that, neurologists are now increasingly comfortable with people breastfeeding, at least on certain medication. And so if you're somebody with higher disease activity, if you're somebody that's keen to think about breastfeeding on disease modifying therapy, then definitely have that conversation with your neurologist. So it may be that you can start a breastfeeding safe disease modifying therapy in that postpartum period.
So, in terms of like the mechanisms of how breastfeeding works, can MS affect that at all? So, could any MS damage interfere with the messages that trigger a milk letdown, for example?
So not directly in terms of the MS, but with breastfeeding and particularly with tiny babies, positioning is everything.
Hmm.
So sort of some of the physical disabilities that people might have or the physical challenges that people might have with MS can prove an additional barrier or an additional challenge to getting that positioning absolutely right.
Mm.
So not in terms of kind of very direct, pretty clearly indirectly that it
Yeah.
can.
Mhm.
But those things are often overcomeable, but might require some external help to work out exactly how to get that right.
Mhm. And I think you touched on this a little bit already. If you want to breastfeed, is it safe to do that if you are taking a disease modifying drug?
Yeah. So that very much depends on the disease modifying drug that you're taking.
Mhm.
Um, in general, um, there are some DMTs that would be sort of completely comfortable with people breastfeeding on. Some where it might be a bit more of an individual discussion with your neurologist, and some, again, particularly those that are not safe during pregnancy as well, that we would say that these aren't compatible with breastfeeding.